We are still very much dealing with 2025 ACA subsidy drama in 2026. I addressed some of your comments, and one comment came from one of our viewers who is through with NHA and pivoting to another organization. Some positive news out of Medicare regarding their fee schedule for 2026. Plus, I have some information on how New York State residents can earn their associate's degree in health information technology for free, and a special announcement. That's right, everyone. It is January 2026. We have a lot of ground to cover. Let's get into it. Let's go. What's up, guys? It's your girl, Tiffany Robinson, aka Coach Tiff from Beyond RCM Revenue Cycle Management. Happy 2026. Oh my goodness, we just wrapped up the first week of 2026. And let me just say, man, what a year that week has been, huh? We have a lot to get into today in terms of healthcare updates. And I don't want to waste any time. I do want to say, if this is your first time hanging out with us, welcome to the channel. Beyond RCM is a YouTube channel that is designed to discuss all things related to healthcare, whether you are a patient, whether you are working in the healthcare space on the administrative side, the clinical side, you are going to find something in this channel, or on this channel rather, that is going to be beneficial and useful to you. So thank you for joining us. But I don't just want you to hang out with us this one time. I want you to like, subscribe, and hit the notification bell, so every time we put out a new update, you will be the first to know. So, I mean, I have notes because there's so much to get into, and I have my readers. I'm at that age now where you need readers in case I need to just pop them to just look, because I can't wear my glasses while I'm recording because the glare, reflects back, and it's just, it's not the best quality video. So the first thing I want to talk about is I want to talk about something that I ended the year on last year, which was the ACA subsidies. And I spoke about the fact that about roughly 22 million Americans were at risk for losing access to healthcare because the ACA, AKA, I did a whole history lesson on this. The ACA is known as the Affordable Care Act, and it's also referred to as Obamacare. Those subsidies that were in place after the COVID pandemic were subject to being stripped away. A lot of Americans were in a panic because they are facing their premiums going through the roof. Now, when I recorded my last video on the ACA, it was still 2025. We were hopeful that Congress would take some type of steps to preserve the subsidies to continue to make the ACA affordable to the millions of people that rely on it. But unfortunately, as of this date in January, as of this recording, there has been no credits or extensions made to the Affordable Care Act. So what does that mean? That means that millions of Americans have seen their premiums increase significantly. Many Americans simply cannot afford to pay these now very inflated costs for healthcare, and they are foregoing healthcare. There are individuals who rely on the ACA because they have chronic conditions. There are individuals who have very high risk conditions. And a lot of people are hurting. A lot of people are hurting right now because these credits and these subsidies expired as of December 31st, 2025. With that being said, all hope is not lost. We recently heard out of DC that there was bipartisan legislation out of the House introducing a bill that would extend the ACA credits for another 3 years. Now, I am very encouraged that I believe, as of my last research, 17 GOP House representatives crossed the aisle to work with Democrats to put together a bill that would at least extend the credits for the next 3 years. Now, of course, this bill also needs to clear the Senate floor, and based on reports coming out from multiple credible organizations, it is looking unlikely that the Senate will approve the bill that got passed in the House. But apparently there are alternate proposals that are being proposed to address the ACA subsidies expiring. And we'll continue to monitor that particular issue. The other issue that we want to talk about is obviously the Medicaid cuts that took place as of this year. And, here in New York State, we're seeing the effects of the Medicaid changes, and we're seeing a reduction in access to Medicaid plans here in New York State. And we're also seeing changes in other states, minor changes, not in California, we're seeing changes and they're not as aggressive as the changes that we see in New York. But we are starting to see some of the states start to respond to these legislative changes. And just like the issue that we're facing with the ACA, with this new recent Medicaid legislation and the different mandates that have been put in place, we do expect to see a significant amount of the American population lose access to care. So that's something that we're definitely going to have to continue to monitor. And we're going to continue to try to provide information as best we can on ways you can access care. But these are the things that's happening in the news. And of course, we always want to make sure that we're talking about evolving topics. On a brighter note, after like 2 rounds of pew pew bad news, on a lighter note, we have reviewed the Medicare fee schedule for calendar year 2026, and Medicare has increased their fee schedule to make accommodations for inflation. So, for all my RCM folks, all my folks working in back office, if you have not checked your rates for 2026, I encourage you to go to your local MAC website and check your fee schedule for your most commonly billed CPT codes, because you will likely be pleasantly surprised to see that the rates have been increased for 2026 to account for inflation. Now, what does that mean? That means that for service dates on or after January 1st, 2026, you should be seeing increased reimbursement rates. That means for your plans that are Medicare Advantage, or if you are dealing with any type of flavor of Medicare, you should see an increase in your payments. So you want to look at those EOBs. You want to make sure that you are being paid according to this recent increase and that you are not being gypped by the payers. So you definitely want to watch out for that. There's so much that we want to get into this year. There's so much going on with healthcare. I just talked to you about a couple of the legislation that's being either enacted or being stalled that's affecting access to care. We're talking about changes to Medicare reimbursement. But another thing that's really changing the healthcare industry, and many industries for that matter, is AI, artificial intelligence. And that is something that we're going to be really intentional about talking about on this channel this year, because AI has been in healthcare for quite some time, but it's getting an even more aggressive push in this season. I have a couple of theories as to why that is happening. Not going to get into it in this month's roundup, but we will delve a little bit deeper into it in next month's roundup. And I do want to say that I am someone who utilizes artificial intelligence, and I have seen the benefits of incorporating AI into some of my daily workflows as someone who works in healthcare administration. And I also see some of the things that I'm very concerned about with AI. And I want to be able to focus on the positives, but also talk about the things that's going wrong, because these things are not necessarily being emphasized, especially by the tech bros. And I think it's important that individuals who work in the healthcare profession understand that AI is here. It's kind of like ICD-10. When it finally got here, we couldn't get rid of it. When EMRs came, it finally got here, we couldn't get rid of it. AI is here and we're not going to get rid of it. But the question becomes, how do we use this technology responsibly? And those are some of the things that I'm hoping to delve into. And I actually wrote an article. If you guys follow me on LinkedIn, I wrote an article for our Beyond RCM LinkedIn page. And in that article, I talk about a recent course that was offered through AAPC. It's called AI in Medical Coding and Billing. In the article, I wrote medical billing and coding because I'm a biller then coder by trade, so it just kind of came out that way. But in the article, I share my experience taking this free course that was offered to AAPC members, and some of the things that I felt AAPC did well with the course, as well as certain things that I felt were glaring omissions from the course that every healthcare professional should be plugged into. I am going to drop a link in the description of the article. This is what it looks like here on LinkedIn. And I encourage you to check it out because that is just kind of like an entryway into some of the discussions that we are going to be having this year as it relates to artificial intelligence in the healthcare industry. Hey, what's up? Just stopping by really quick to make a quick ask. We've been reviewing our data analytics, and we've noticed that we have tons of new individuals checking out our channel, which is geared towards all things healthcare. However, many of our viewers are not subscribed to our channel. Subscribing to our channel allows our content to go into the proper algorithms so that we can spread knowledge related to the healthcare industry to all those who are interested or looking for guidance. So can you do me a favor? If you haven't done so already, can you please like, subscribe, and hit the notification bell? That allows our information to get into the hands of those who truly need it. Thank you so much for helping us out in this way. Let's continue being great together. All right, guys, welcome back to the channel. I hope you are enjoying our content thus far. It's been a while since I have gotten into comments that our subscribers post on our YouTube channel. So today I want to give you guys a special treat and just respond to a couple of comments that we received recently. So the first comment comes from @Echo Samoa. I hope I'm saying this right. And @Echo Samoa's comment says, I currently have a CBCS certification with NHA, and I'm not going to renew because no employers are asking for it. I have been trying to get a job for 8 months, and not one employer has requested an interview. I am not renewing with them, and I am now going with AAPC. Do not get certified with NHA. It is a waste of time. So @Echo Samoa, first and foremost, I want to thank you for being a part of our Beyond RCM community. And there's a couple different things to unpack with your comment. First and foremost, I do completely sympathize with the frustration of trying to find your first position, especially when finishing your certifications. I have been very vocal about the fact that I initially started out with NHA in some of my earlier videos, and I made the decision several years into my career to step away from my NHA certification, and I pivoted to AHIMA to get my coding certification, and then eventually went to AAPC to become certified in clinical documentation. So I want to unpack two different things that you're experiencing right now. The first problem is finding a position. And I do want to emphasize that no matter what organization you decide to get certified through, there is most likely going to be a challenge for that first year or so breaking into the industry, especially if you don't have any previous experience or training in medical billing or medical coding. So that's just something to think about. Even as you look to transition over to AAPC, you are still going to find that it can be a little bit challenging when you're trying to break into the industry. And you have to really be prepared for it. I actually attended one of our monthly AAPC chapter meetings, I think about 2 months ago. And the presenter was a risk adjustment coder. And she talked about her journey breaking into the industry. And it took her over a year to land her first position, and that's with an AAPC credential. So any individual that's looking to break into this industry, I've said it before and I've said it again, you have to pack your patience. This field is not for the faint of heart. If you are someone that gets easily discouraged, if you are not going to do well with rejection, if you are not someone who is persistent, or if you don't have someone that's hooking you up and getting your foot in the door, you have to be prepared to really tough it out if this is something that you really want to do, and continue to put yourself out there and eventually you will get an opportunity to get your foot in the door. Sometimes you have to get creative with how you go about doing that, but you're going to have to be persistent. So that's the first point that I wanted to make. The second point that I want to make is I do agree with you. When I left the NHA, I felt that they were significantly behind what other more prominent regulatory individuals, I'm sorry, more prominent regulatory organizations were doing in the medical billing and coding space. And I haven't been involved in NHA for quite some time. But based on certain boards that I have sat on, academic boards that work with NHA, um, I don't think that they have done enough to make themselves be on par with some of the other regulatory organizations like AAPC and AHIMA. So I am not surprised that individuals are still going through NHA to get medical billing and coding certification and still having a hard time because a lot of employers are not recognizing the credential. And that is true. If you look at a lot of the positions for medical coders, for medical billers, NHA is not a requirement. One way to work around that is maybe looking into private practice. Oftentimes, private practice are not as stringent as hospitals and other larger institutions when it comes to coders. So that may be a potential avenue for you to look in. But I do want to encourage you to hang in there. Don't give up. The beautiful thing about AAPC, which I have been a member now for going on 6 years, is AAPC has a very big community. They do a lot of chapter meetings that help you to deepen your understanding in coding, to deepen your understanding in evolving topics in revenue cycle management. So you will definitely see that once you pivot to AAPC, you're going to get a different type of quality in terms of the experience that you are going to have, whether you're pursuing your certification in medical billing or medical coding. So I do want to thank you, Echo Samoa, for reaching out to us. Please keep us posted about your journey. And if you have any additional questions or concerns, please do not hesitate to reach out to us. We will be happy to support you and provide you with information in any way that we can. Welcome back, guys. I told you we got a lot to talk about this month in our RCM Roundup. All right, so for our next topic, I want to talk about something exciting that is happening in New York State. In New York State residents have the opportunity to earn their associate's degree under something called the NYSOP program. Now, the NYSOP, and I'm gonna need my readers, the NYSOP program stands for the New York State Opportunity Promise Program. So I sit on the board of Gutman Community College. I've been sitting on their board for about the past year. And we had a meeting a couple months ago where I found out about this NYSOP program, where New York State residents have the opportunity to earn their college degree for free. So I immediately started digging after that meeting to get the information. So of course I can put our Beyond RCM community up on game. Hello. So what is the NYSOP program? It is an initiative to help adults gain associate's degree programs in various areas. And of course, the area that piqued our interest is the area of health information technology. So if you are between the ages of 25 and 55, if you live in the state of New York, come on now, you can't be up in Arkansas talking about you trying to apply to the NYSOP program. If you are a resident of New York State, if you are between the age of 25 and 55 as of your first semester, and if you have not previously obtained a college degree, you can qualify for free tuition, free books, and additional supplies through the NYSOP program. I am going to drop a link in the description of this video. I encourage you to review it and do your due diligence. This is an amazing opportunity for New York State residents who are interested in entering this field and getting deeper knowledge to get your foot in the door and have your tuition covered by the state of New York. So we're definitely going to get that information over to you guys as soon as possible. And while we are on the topic of continuing education, I did mention that I had a special announcement to make, didn't I? Well, my announcement is I am officially in grad school. Yes, Coach Tiff, constantly going out there sharing information. The teacher is once again becoming the student. I officially started grad school as of last week. And, I think it's too early in the game to say one way or the other how it's going. But I'm excited. I'm excited to take this journey. I have contemplated for many years if I return to school, particularly university, what would I pursue? I didn't want to do something like, getting my MBA or getting a master's in healthcare administration because I've done this for so long that I didn't want to go and just pretty much be exposed to a lot of things that I'm already exposed to. I wanted, if and when I returned to school, to be something that was fresh, something that would give me a new perspective and enhance what the knowledge that I already have. And the area that I kept finding myself going back to in these last couple of years is healthcare law. So I am currently working on my master's in healthcare law. I am attending NSU Florida online. And the goal is to take my time. I'm in no rush to finish this program. I'm actually just doing one class a semester. I want to take my time. I want to absorb the information. I have nothing to prove to, the healthcare industry. No shade, but speaks for itself. Not trying to be cocky, but speaks for itself. But I am excited to explore this new chapter and learn and grow. And I did start classes last week. And the funny thing is, when I started classes, I was battling the flu. So I was sick and feeling like crap. And it was my first day of class. And I had a meltdown for like the first hour or so of class because we're on Canvas and I am not experienced in Canvas. When I did my undergrad, we were on Blackboard. So Canvas looks a bit different. Plus, I finished my undergrad like 14 years ago. So I had a little bit of a meltdown and I was asking myself, like, girl, why did you do this? Like, why are you even back in school? You don't even need to go back to school. You should just quit. Like, I had all these different thoughts going through my head. And I was like, girl, slow down. You can't quit. You paid for this class. So if you're going to quit, you're going to have to quit after you finish this class. But needless to say, I kept pushing myself and I said, just take your time, breathe, Tiff, just take your time and go into the different areas. And eventually I was able to kind of figure out my way and what I was supposed to do for that week and my assignments and whatnot. And I was proud of me. I finished my week and I was like, I'm proud of you, girl. So this week it's a little bit more than what we worked on last week, but it looks manageable. And I know every class is not going to look like this class, but I do want to say, my first course that I'm taking is a professional communications course. And when you look at the syllabus, you kind of think like, well, I communicate professionally every day. Like, why do I even need to do this course? But in just saying, slow down, Tiff, breathe, take your time. You want to absorb this information. And even taking a step back and having that mindset going into the course, there were a couple things that I walked away with from last week's lesson that I think have benefited me. So just that alone lets me know that this is going to be a journey that will definitely stretch me in a different kind of way. And I'm going to approach it with an open mind and an open heart. So Yeah, your girl is going back to school. The lifelong learner is going back to school, and I'll definitely provide some updates here and there as I go through the process. But I hope, even me going back to school encourages any of our viewers. Maybe you've been contemplating going back to school. Maybe you feel like I'm too old to go back to school. I mean, personally, I don't think I'm old. I'm 44 and I think I'm pretty hip and happening, which my kids make fun of me and say the fact that you say hip and happening means that you're old. But I think I'm pretty hip for 44. So I don't consider that old. But some people may consider going back to school in your 40s, like you're too old. So I hope that by hearing, my journey of returning into grad school inspires, or entering or enrolling into grad school inspires you, if that's something that you've been thinking about. But that's it, guys. Thank you so much for hanging out with us. I know we had a lot of information that we had to plow through in this month's RCM Roundup. We have some really exciting topics coming up in the next couple of months. And we also have a new masterclass that we're going to be dropping, I think, sometime in the spring. So continue to hang out with us. If you haven't done so already, don't forget to like, subscribe, and hit the notification bell. And I will see you in the next roundup. Peace out.